Good evening, everyone. I am Dr. Jayagopal, Director and Head of the Department of Cardiology, Lakshmi Hospital, Palakkad, Kerala. This year, HFAI had a very focused sessions on personalizing heart failure therapy. In fact, over the last few years, the incidence of heart failure has been increasing, and this is really becoming a challenging problem. In a country like India, where the prevalence is close to 1%, and with a large population of more than 140 crores, the percentage of people suffering from this disease is phenomenal. We also see that many patients who are admitted with acute heart failure in our country, they have a very high mortality of close to 7%. And when you follow up these patients over a period of 1 to 5 years, the rehospitalization rates as well as the mortality becomes even much higher. In fact, this is worse than some forms of cancers like breast cancer and prostate cancer. So much so, when we look into the reasons why this has such a high mortality and morbidity rates, we understand that the drugs which are effective for treatment of heart failure, the so-called 4 pillars, are not really being utilized properly in our country. In fact, in our own Indian College of Cardiology National Heart Failure Registry, at discharge only about a quarter of our patients receive these medications. So world over, this is a problem. It's not just India. If you look at the CHAMP registry, only 1% of patients receive all this therapy in the right targeted dosage. So where does the problem remain? In a country like India, when we analyze, it's also lack of awareness amongst the patients, lack of physician awareness about the newer developments, and also the cost and many other socioeconomic factors. So one of the areas that we really are focusing today is to improve the physician awareness. Apart from education, newer innovative strategies have been thought of in the Western countries, like use of digital technology in following up these patients. But in a poor country like India, we are thinking of a novel innovative strategies to address these issues, and that's what essentially my talk today was. So we have actually designed an Indian heart failure profiling wheel where, in the center, it's all the relieving congestion and the guideline directed therapy which are focused, and the spokes of the wheel actually would represent the various comorbid conditions which are phenomenally high in heart failure, like 50% have diabetes, 50% have high blood pressure, many have chronic kidney disease, high potassium levels, and for each and every comorbid condition, each spoke would tell you what to use and what not to use, and these are labeled as green, which can be utilized or indicated therapy, red if it is not indicated or contraindicated, yellow to use with a caution. So this would be an easy tool which would be available on the physician's desk, and we are trying to propagate this philosophy by sending out these heart failure profile to many physicians in the country, and as a first measure, we aim to target this to at least 20,000 physicians in the country. So the feedback has been good. We looked into the awareness of heart failure therapies in India. It's very dismal, and hopefully when we give this wheel and do a survey later on, see to what level this has improved, that will be the testing of this hypothesis and this new innovative strategy. But I'm sure this is over the last 1 month we have had excellent feedback from physicians and the cardiologists all over, and I'm sure this cheap innovative strategy for a country like India would save millions of lives. Thank you.